Hello and welcome to this short webinar on New York Medicaid's coverage of therapy services. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides, sample policies, and forms on Medicare, Medicaid, HIPAA, TRICARE, and state rules and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit the website at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. This presentation describes New York State Medicaid fee-for-service coverage of therapy services. Medicaid managed care companies must offer the same amount of care as the state, but can change prior authorization, personnel, and documentation guidelines. MCOs do follow state rules in many cases, but therapists should always double-check with payer policies. The website contains New York-specific detailed information on outpatient therapy services, fee schedules and code lists, billing for non-covered services, information on qualified Medicare beneficiaries, information on MCO plans, and members can always request information or ask questions about Medicaid coverage and compliance. Qualified practitioner means a therapist who has passed the necessary national examination, obtained state licensure, and performs within the scope of a license as regulated by federal and state governments and as defined by the appropriate professional organization, such as the APTA, the AOTA, and ASHA. Physical therapy assistants or occupational therapy assistants may provide services under the direction and supervision of the respective physical or occupational therapist. Certified teachers of the speech and hearing handicap, or certified teachers of students with speech and language disabilities employed by the federal, state, or local government, or by a public or non-public elementary or secondary school or an institution of higher learning may provide speech therapy services under the direction of a qualified New York licensed and currently registered speech language pathologist in the course of such employment. Aides, athletic trainers, exercise physiologists, life skills trainers, special education teachers, paraprofessionals, and rehabilitation technicians do not meet the definition of a qualified practitioner, regardless of the level of supervision, and their services cannot be billed for. Rehabilitation services must be ordered in writing by a physician, physician assistant, or nurse practitioner so authorized by law. Speech therapy services may be provided based on a written referral from a speech language pathologist so authorized by law. Restorative or long-term physical, occupational, or speech therapy services are considered medically necessary when the therapy services require the skills of and are delivered by a qualified practitioner, and the beneficiary has been evaluated or reevaluated for the continuation of therapy services and has an established treatment plan with reasonable and attainable goals that can be objectively measured by the use of standardized or non-standardized measures and tools. The beneficiary has identifiable clinical condition diagnosis, is symptomatic, and the therapeutic interventions are directed at preventing disability and/or regression, improving, adapting, or restoring functions impaired or lost as a result of a specific illness, injury, neurodevelopmental disease or condition, surgery, loss of a body part, or congenital abnormality. And therapeutic benefit has not yet been reached, and therapeutic interventions are for conditions that require the unique knowledge, skills, and judgment of a qualified practitioner and cannot or have not been met by a comprehensive maintenance services program or home program. And there is a reasonable expectation that the therapeutic interventions based on a beneficiary's rehabilitation potential will result in objective, measurable functional outcomes within a reasonable and predictable period of time, and the outcomes are documented in the beneficiary's file. And the treatments are not routine, education, training, conditioning, or fitness, and the beneficiary's function cannot reasonably be expected to improve as they gradually resume normal activities. And the treatments are not a duplicate therapy, and the treatments are solely recreational, and the beneficiary has not refused therapy. A PT, OT, or SLP therapy treatment session should be based on the beneficiary's specific medical condition and supported in the treatment plan. A treatment session may include reassessment of the beneficiary's deficits, progress, rehabilitation potential, plan, and goals, therapeutic exercise, including neuromuscular reeducation, coordination, and balance, therapeutic oral motor, laryngeal, pharyngeal, or breathing exercises, functional skills development and training, manual therapy techniques, including soft tissue mobilization, joint mobilization, and manual lymphatic drainage, assessment, design, fabrication, application, fitting, and training in assistive technology, adaptive devices, orthotics, and prosthetic devices. Therapy services also include management of positioning, eating, and swallowing to enable progress, safe eating and swallowing, electrotherapeutic modalities, physical agents, and mechanical modalities when used in preparation for other skilled treatment procedures, training in assistive technology and adaptive devices, speech-generating devices, training in the use of prosthetic devices, training of the beneficiary, caregivers, and a family in home exercises, activity programs, and the development of a comprehensive maintenance program. Duplicate therapy: the same therapy services and/or treatments provided by more than one therapy type, both physical and occupational therapy, or both occupational and speech therapy, or the same discipline in different settings. Each specific discipline or same discipline in a different setting should, absent of unique circumstances, be documented in the medical record. Have a unique and specific evaluation, treatment plan, goals, and therapeutic interventions. Evaluations are an assessment of the beneficiary's physical and functional status used to determine if PT, OT, or ST services are medically necessary, gather baseline data, including objective findings, and establish a treatment plan with reasonable and attainable goals within a defined period of time. Evaluations are administered with appropriate and relevant assessments using objective measures and/or tools, and the evaluation is required prior to implementing any treatment plan. The evaluation should include prior functional level, specific standardized and non-standardized tests, assessments, and tools, summary of baseline findings, objective, measurable, and functional descriptions of the beneficiary's specific deficits, summary of clinical reasoning with recommendations, plan of care with specific treatment techniques and/or activities to be used in treatment sessions, frequency and duration of the treatment plan, functional, measurable, and timeframe long-term and short-term goals based on the beneficiary's relevant evaluation data. The goals should be reasonable and attainable based on the beneficiary's specific condition, rehabilitation prognosis, including the level or degree of improvement expected, and discharge plan initiated at the start of treatment. Treatment notes should include the date of treatment, specific treatment provided that match the procedure code's billed, total treatment time, beneficiary's response to treatment, progress towards goals, any problems or changes to the plan of care, and the name and credentials of the treating clinician. Reevaluations are an assessment done to evaluate progress or to modify or redirect therapy services when there are new clinical findings, a rapid change in status, or failure to respond to the therapeutic interventions. A reevaluation includes all components of the initial evaluation, in addition to discussion regarding the appropriateness of continuing skilled therapy, a list of current problems, and deciding a priority such as focus of treatment, identifying the appropriate interventions for new or ongoing goal achievement, modification of interventions, revision of the plan of care as needed, correlation to meaningful change in function, and deciphering effectiveness of interventions. Thank you for watching, and please visit the website at therapycomply.com for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe, and we'll be adding many more videos soon.